Amendment at the desk.
The clerk will report the amendment. Is this Murphy?
One.
Murphy 1.
Amendment to the amendment in the nature of a substitute to committee print offered by Mr. Murphy.
Without objection, the clerk will suspend reading without the
So it's
amendment.
being read, Mr. Chairman.
Yes, and recognize the gentleman from Pennsylvania to talk in his amendment.
Thank you, Mr. Chairman. First of all, I want to thank you, Mr. Chairman, for working with me on including important provisions in the text of the amendment in the nature of a substitute to allow states to use some of the $100 billion to expand access to mental health and addiction treatment services. But I'd like to again clarify some important points on mental health and substance use treatment parity laws. There are two laws that govern parity. The Mental Health Parity Act of 1996, Public Law 104-204, signed by President Bill Clinton, and the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act of 2008, Subtitle B of Title V of Public Law 110-343, signed by President George W. Bush. Since first passage, mental health parity has been a bipartisan issue, and it's my hope and intention that we remain working together to help families in need. We on both sides of the dais have clearly and consistently demonstrated our joint commitment to providing better care for the mentally ill. I've drafted this amendment, and I ask a counsel at the desk to walk through a couple of details with me if I can ask some questions of counsel. As my amendment would ensure that there will be no changes to any existing mental health parity laws, may I ask, does the amendment in the nature of a substitute change the 1996 parity law?
No, it does not.
Does the amendment in the nature of a substitute amend the 2008 law?
No, it does not.
Does the amendment in the nature of a substitute make any changes to the 2016 21st Century Cures Act that included the Helping Families in Mental Health Crisis Act for oversight, accountability, and enforcement of parity laws?
No, sir, it does not.
Well, thank you. So to be clear, the amendment of the nature of a substitute under consideration right now does not change any existing parity law in any way, correct?
That is correct, sir.
So, Mr. Chairman, I'd like to thank the organizations which endorsed my amendment and ask their letters to be accepted into the record. These organizations include the American Psychological Association, the American Psychiatric Association, Mental Health America, National Alliance on Mental Illness, American Academy of Child and Adolescent Psychiatry, American Foundation for Suicide Prevention, the Eating Disorders Coalition, the Association for Behavioral Health and Wellness, the Multi-Care Health System, the National Association of Psychiatric Health Systems, the National Council for Behavioral Health, and the Treatment Advocacy Center. Mr. Chairman, I ask that their letters also be...
Without objection, they'll be entered into the record.
And as we've confirmed, there is no change in mental health parity. I will withdraw my amendment as we've established it's not necessary. But I would further urge my colleagues to join me in our ongoing efforts to help families gain access to quality treatment. So, coverage without access to care is meaningless. To improve access to care, we need to increase mental health workforce by the number of psychologists, psychiatrists, psychiatric nurses, and clinical social workers. And that's what we did in a bipartisan way when this committee passed the Helping Families in Mental Health Crisis Act and the 21st Century Cures Act, which became law. We have much more to do, including expanding access to inpatient beds for addiction and mental illness. And I look forward to working with my colleagues on this because we lose 350,000 American lives each year to this deadly disease, which impacts millions of lives. So I withdraw my amendment and thank the chairman.
Gentleman yield.
So the